Hello everyone, Dr. Cox here, and I wanted to talk about the myriad of changes that a patient can go through after surgery. I kind of categorize these into like emotional, spiritual changes, and by that I mean when you look in the mirror and there's a physical change, especially a positive one, it may alter your confidence, and your confidence exudes in some lifestyle changes and things like that. So that's a very powerful something not to take lightly. It's very cool to witness. And then there are physical changes, and that's what I really want to concentrate on with this. So, you will undergo a myriad of physical changes after surgery. It is a journey. And the reason I mention this is because sometimes patients at the consultation ask a question, always of, will I be healed by fill in the blank? And I've heard it as short as 2 weeks, 4 weeks, but not really longer than a month. And so that kind of got me thinking maybe people make assumptions or expectations of, well, I think I should be healed in this amount of time. This is not right or wrong, it's just simply an assumption. But there's a little more nuance and complexity to it. I think some of it is because we live in a fast world, a very industrialized kind of new world where we have instant gratification information at our fingertips. And so we're used to that type of navigation throughout the world. But however, our bodies are not on Wi-Fi. They are old school OG kind of wound healing process, which is a very complex biochemical change that the body undertakes. It's very interesting and cool, actually. But anyway, so considering that in mind, I have a kind of conversation with patients about what to expect. You're going to be healing for several weeks and months. And that doesn't mean, that scares some people. That doesn't mean you're going to be looking like you've been in a bar fight for a year. It just means that the body is undergoing change. And I see you in intervals that try to match that change so that we can discuss it and you're prepared and aware of it. But typically, the macro changes that you'll see when you're healing are in the first month for sure. The first week, I call it the inflammatory phase. You're going to see that bruising and swelling, the body's initial reaction to the surgery that was done, especially the more you do. If you just had your uppers done, your lowers, your brow, you add on a skin treatment, a laser, microneedling, whatever it may be, all of those collectively are going to put you on a path of healing in a certain time frame. So, in that first week, 2 weeks, you're going to see the most visual changes, the vivid changes. And then at a month, you see more fine detail changes. And by that, I mean a little bit of swelling residually, the incision fine details, and they are texturized, ropey or lumpy and bumpy, and colored. So they can be pink to red to purple, depending on your natural skin tone and skin type. So this is a normal thing to see. Now, those changes that I just mentioned will continue to change by 3 months, 6 months, and it's usually overwhelmingly in a very positive direction. By that, I mean just getting better and better, getting smoother, skin getting more rejuvenated as those skin proteins are built if you had a skin treatment. So it takes time. That said, it's just something to be aware of as you're going through the physical journey of healing after a surgery. I think it's very important because all patients rely on are what they see in the mirror every day. You see your provider at punctuated visits, and so you're seeing yourself every single day. So you may not appreciate those little nanoscopic changes, but collectively, and it's important that you come to your post-ops and follow-ups because then you can see them in the pictures, you can discuss them, and come up with any plans that are needed at the time. But I think it's just important to understand the physical journey, and the emotional, spiritual one is a whole nother conversation, but they certainly go hand in hand. So thank you, and let me know if you have any questions.